Over the weekend, continued in the trajectory of where we do not want to go. We have, for the first time, broken the 4,000 deaths in a day plateau. We did it twice. So that's not ideal, obviously. Obviously, with Sunday, things calmed down a little bit, which is good. We'll see where things go for the next couple of days. Here locally, they've been reporting mortalities kind of in blocks. So all of a sudden you'll have none, and then 25, and then none, and then 19. So I'm not 100% sure. I haven't been able to figure out exactly why that is. But clearly, we are seeing mortality both locally and statewide, and certainly nationally. Fortunately, from a hospitalization standpoint, it does seem that things have calmed slightly here in the last several days, which is good because there was the concern that this could be a time where we start to see some escalation. Unclear whether that's just one of those plateau and spike phenomenons where things have calmed a little bit, and that we could be rearing up for another spike. There's a lot of concern that's been discussed in the last couple of days about the Bills games. So I can say, as someone who forgot something and had to go to Wegmans for like the first time in weeks and was terrified about what it was going to be like to go into Wegmans. And I went and I felt like I was the only person at Wegmans, and then realized it was coinciding with the same time of the Bills game. So I actually think there might have been a lot of people either clustering, hopefully in their own homes, but potentially clustering around other people watching the Bills games. And now that the Bills are going forward, and the potential that they could even make it farther into the playoffs, and what that could bring is a whole side discussion in and of itself. Root for the Bills, just do it in the safety and comfort of your own home. Largely, I think what we're seeing at the moment is that hospitals are still pretty full. We are doing okay, although still very much so within our surge capacity. Staffing remains an issue, as we talked about last week. They have officially closed the Sawgrass facility and have borrowed that staff to provide hospital coverage. Clearly we're still seeing the effects of everything being on edge. The modeling does estimate that this will continue at least for the next couple of weeks into probably the third to fourth week of January. As I understand it, there was one model that was revised over the weekend, or at the very end of last week, as far as where things could go. That was shocking to everyone, so much so that they are now recalculating and making sure that that actually is correct, because it was projecting that we would be in a much worse circumstance than it even appears that we are on by current trajectory. So we'll probably learn more about that in the next day or so. But certainly with the national mortality statistics, we are not where we want to be at this point in time. As for regional statistics, as we go forward, we have seen a spike in Wyoming County in particular. And actually the data sent to us by our Tri-County friends confirms that. There were several, it does again seem to be congregate situations where people attended events, get-togethers, but then a lot of it is just passing within households, unfortunately. Now, Wyoming is interesting just because it's such a small community. There's only 40,000 residents of Wyoming County. So obviously there's not a lot of folks probably getting tested, and those folks, when the cluster does appear, even if it's a relatively small household cluster, that can jack up the percentage positive numbers very quickly. So it doesn't necessarily reflect the raw number of people who are sick, just that disproportionately there was this spike that happened. And I think there was another maybe group home or nursing home. There's only one nursing home in Wyoming County, but I think maybe it was a group home that had a little bit of an outbreak as well. But as you can see, overall, there seems to be this kind of plateauing effect at the moment, pretty much across the Finger Lakes region. So hopefully we'll see if that persists. Like I said, there's still some concern that we may just be getting into the New Year's and residua from the Christmas holidays. So we'll see where that goes over the next couple of days. I think that's all I wanted to talk about the current state of the union. So I will go ahead and move into testing. I did get word from our friends over in the pre-procedural testing facility that some of our subspecialty practices are still not doing a very good job of sending in the requisition with the patient. So it's not the primary care groups. I know a lot of our subspecialty practices don't join these calls. So they will begin, if they haven't already, turning folks away. So if any of you are in the subspecialty practices and feel that this may apply to you, please know that they are starting to they're starting to enforce the threats that they have made thus far, that they will turn patients away and not do their testing if they show up with no requisition or computerized order. So that's becoming a big issue that's starting to take a lot of time as the volume of testing has gone back up. So as we talked about before, I think they were averaging somewhere around 2,500 tests a day, right around the Christmas and New Year's holiday weeks. And then very quickly after the New Year's break, they surged back up to about 3,000 plus tests per day. So with schools restarting and all of that, we anticipate the demand for testing to continue to climb, especially as the infection rates climb as well. So it's going to make it even more important that we try to dot the I's and cross the T's and make sure that patients are getting there with those requisitions in hand. One other thing I want to make people aware of, and unfortunately I deleted the email and I can't remember the name of the company. There is a company that is fairly aggressively reaching out to people about a PCR platform that has about, I think it's 94 wells to be exact, that they are trying to market to practices and small laboratories, urgent cares. As best I can find, it's kind of a scam operation. I found nothing validating or that there's FDA approval for the test that they are offering. They make a big promise in the email about the financial benefits of doing the testing. And then you go to their website and the website really does look like something that a high school kid probably put together. So just know if you're getting outreach directly from a company that does not seem like a Roche or one of these larger companies, I would be very skeptical at the moment because I think there's a lot of scamming attempts. I know there was just a guy in Buffalo who got charged and arrested by the federal authorities for selling point of care antigen testing. And he had sold somewhere like 50,000 tests to practices in and around the Buffalo area. This one that I received, and I guess others did as well, was a PCR platform. So people are starting to try to market to the masses. So just be aware if there's outreach of that. Oh, there you go. Renee saved the day, MicroBioDX. So they are very persistent, but not very forthcoming with information, and get very touchy when you question whether or not there's any evidence of a FDA authorization and the like. So I would be very conscientious of those folks. So there's that. Now on to vaccines. First and foremost, under penalty of law and threat of your life, please do not hand out Renee's phone number. Poor Renee is getting inundated with patients and people calling, asking her about vaccination, when they can get a vaccine, how do they sign up. As omnipotent as Renee is, she has no control over signing up patients. And it will be the first way to Renee rolling your house if she finds out that it came from your practice. So as someone who tries to stay on Renee's good side, please, for the love of all that is holy, do not give out Renee's phone number because that will not be received positively.
I'm still happy to help healthcare workers, affiliated or not, happy to help them because I have information I can share with them. When the time comes that we're able to help patients, okay, I'm not volunteering to have my number, put out there, but at least I'd be able to help patients when that time comes. But right now I can't help them. So thanks, Chad. I appreciate you putting that out there.
No, there's only so far we can go. Now everyone's question is probably likely about the acceleration that the governor has put forward for vaccination. So many of you probably know teachers got accelerated last week. And this week they made the determination to accelerate those who are 75 and older. Now there's been a little bit of conflicting information, I will say. This is not unusual, and likely we will get further clarification hour by hour and day by day. So even as the governor's office put forward that 75 and older would go live today, they did put in a stipulation that says you must complete your 1A before you move to 1B, and 75 and older would be the 1B. They also had accelerated the essential worker class, which is also a bit vague at this moment as to who all falls under that essential worker classification. So all this is to say, several folks have reached out and asked, at this moment, what is unclear is to date, much like we ran into when we were trying to get all of our teams vaccinated, the governor's office has been very controlling of when and how you use vaccine that is allotted to you. So unless it has specifically been earmarked and you have been told that you can use the vaccine for that purpose, you are not able. So for instance, before, when the vaccine was approved for healthcare workers, Strong had not been, or UR Medicine had not been given the go ahead to vaccinate community providers. And it wasn't until they got that blessing that they were able to do so. Sometimes they send you allocation of vaccine that says, here are the people that you can use this for. And you do not have the discretion, as any of you who are going to be vaccinating will find as you get allocation yourself, you do not have the discretion to use it for other purposes, even if that group has been suddenly now tiered as appropriate. So all that's a long way of saying, at this exact moment, there's still a lot of clarification that is being done to try to figure out when and how we're going to go about vaccinating that 75 and older group. There are several efforts that are going on simultaneously. Yep, there's lots of sharing going on in the chat room. Thank you very much, Eric. So for the 75 and older crowd, there are probably one of three or all of the above that's going to happen. Number one, there are going to be some initial attempts at large vaccination sites. So I know that there's already efforts to try to stand one up at probably Strong Memorial as a kind of get our feet wet, try this, see how well we can do. That will be with people signing up for slots of time. Number two, there's already some discussion and plans underway to set up large vaccination venues, such as Blue Cross Arena and the Riverside Convention Center. That is obviously going to involve a larger group of folks, probably the health department, maybe some of the community pharmacies. All those details are still being worked out. And then there's other ripples of, will we use the YMCAs? Will we use some of the school systems? So all of those things are being conceptualized at this moment. So that's number one. Number two, we anticipate that community-based pharmacies, CVS and Walgreens in particular, will be allowed to vaccinate the public. So whether or not they will be able to open up vaccination clinics, probably with scheduled times for people to come and get their vaccination, we anticipate that will and or may become a reality here in the next coming days. The third, which I know is what most folks on here are interested in, is that for anyone who has signed up to be a vaccination site, you may receive vaccination allocation directly. Now, it probably will not just show up in the mail one day. There'll probably be a little bit more advanced notice than that. What we had initially heard is that the vaccine for practices may come through the central hub, a la either the health department or UR Medicine would receive the vaccine and then distribute it just in time for administration on site. That's important because unless the vaccine is going to be used in a relatively timely fashion, it needs to be stored at pretty cold temperatures. Once it's thawed, and especially once it's allocated, you only have an hour to get it into arms. So, for all of us, if we're starting vaccine clinics and you get Moderna, which is probably unlikely any of us would get Pfizer in the short term, but you get Moderna, there's 10 to 11 doses per vial. And from the time you draw that up, you got to get it in the arms in an hour or less. So you got to, kind of have a plan in place that you can get 10 to 11 people within an hour's time frame of when you draw it up. And then there's the funkiness of the vaccine. It doesn't like to be shaken or stirred. So you got to kind of leave it setting on a table kind of thing. So all these things, logistics, we'll have to figure out as we get into the how will vaccine filter out to the various practices. What I can tell you is that because this is not approved for age groups younger than 16, it is almost unheard of that pediatric practices will be getting this vaccine anytime soon. It very well may be going to family medicine and medicine practices. There had been some discussion of can we use all available resources to administer the vaccine so that even peds practices could get it and then administer it to adults in their practice. One, I know nobody's sitting around with just ample time on their hands to just start administering vaccines to the masses. But two, I just don't think that they have the disbursement plan to be able to do that at the moment. So I think the likelihood is the first rounds of patients are going to get vaccinated probably at the hospitals. Then we will probably see some large vaccination sites where people will be invited to come. Then we may see from there community pharmacies and your practices getting involved after that. What exactly that timeline is, I don't have a great answer, but it should happen probably within the coming days, I would imagine. And I see the chat room is blowing up. So LJ and Renee, you can stop me at any time if there's something that I need to shut up about. Okay, I see shaking heads. Okay, good. 75 and older, right now there is no other criterion that has to be applied. The next tier, which will be tier 1C, we do not have a timeline as of yet. Probably 1 to 2 weeks would be the estimate. That will be 65 and older and or chronic medical conditions as it currently is stipulated. Now, the key to this is we are getting very close to inauguration. And that's going to throw a different curveball into all of this for multiple reasons, as probably many of you have heard. Number one, there has been a big push within the Department of Health and Human Services to get rid of the tiering program altogether. There's a lot of discussion that tiering is actually what's slowing down vaccine administration. And so it is potential that they will wipe out that tiering at any time. As many of you may have heard, Azar, the Secretary of Health and Human Services, came out, I think, middle to end of last week and basically said we should do away with tiering effective immediately. No one has adopted that. Certainly the states has not adopted that, but it's out there and could be enforced at any moment. Number two, with the inauguration, Biden, as many of you have probably heard, has at least put forward that his plans or his team's plan is to no longer hold second doses in stock, such that any dose that's available would be pushed out for first dose administration. Now, I got to admit, that scares the hell out of me. We don't know that production and delivery is going to keep pace at the moment. We all hope it will. But the worry is that we do a lot more first dose vaccination and don't have the promise of second dose delivery, then we could get to a point where we have to restart the vaccination sequence for everybody who just got vaccinated. And that would be a big mess. So there's a lot of conflict and discussion going on right now about that, whether or not that will actually hold true or whether it will kind of die on the vine. I think even Biden said that he was going to listen to the recommendations of the scientists and the doctors. So I think if there's enough of a pushback to say that that's not a good idea, I think people will kind of probably step back from that. Whether or not they may choose to keep a small supply on hand and then release more for primary dose administration, I guess that's possible. The push in the last 24 hours, and this is true basically from the data that we see, there are 22, 23 million doses, I think, that are now in circulation at the moment, and somewhere on the order of about 7 to 8 million doses that have been administered. So it's not the paucity of availability of vaccine, it's the paucity of actually getting it into arms at the moment. So releasing first doses or releasing all doses for first dosing may not accelerate the administration plan. So anyway, that whole process, either getting rid of the tiering and or seeing a glut of vaccine enter the space or flooding the zone, may change all of this and may accelerate this process even further. So no doubt, I'm sure practices are getting inundated with phone calls. That's probably unfortunately not going to slow anytime soon. And, as of right now, today, if there's a 75-year-old standing at your door begging to be vaccinated, even though they meet criteria, I don't know of a place that they can go to get a vaccine at this exact moment. That may change in the next 30 minutes. But for right now, we will be getting to them probably within the next couple of days. But just because they said go at 8 a.m. this morning doesn't mean that it's really go time just yet. I think that's a lot about vaccines. That's about all I've got at this moment. We are still working to get through the 1A. So the goal was across the spectrum, whether or not it was required or not, to try to complete 1A administration this week. So again, for any of you who are on this call, who your team has not been vaccinated and they'd have any patient-facing responsibility, please reach out to us and let us know. There should be no one that can't, in a 1A category, that can't get vaccinated immediately. I know there has been some pushback about Pfizer clinics in that link through the U of R that are not available. Those links are evergreen. So if someone is beholden at the moment that they absolutely must have Pfizer, if you just keep checking that link, they will continue to refresh as Pfizer vaccine gets delivered and as new vaccine clinics get added. Otherwise, I know that even right now, as of this moment, you can sign up to get the Moderna vaccine right now. For all intents and purposes, unless you have dermal or lip fillers, I don't know of another reason why you couldn't get the Moderna vaccine or why the Moderna vaccine would be preferential at this point. So for the vast majority, it's probably tit for tat at the moment. But if someone is hell-bent that they really want the Pfizer vaccine, we're somewhat beholden to what the distribution is. The Pfizer vaccine, we got that initial 100 million dose allotment. There was the anticipation of another 100 million doses, but remember that a lot of the production by Pfizer is actually going elsewhere in the world and not to the US. So there may not be as many Pfizer vaccine clinics as Moderna here in the short term. So more on that, but those links, as I said, those remain evergreen. Please, again, people have to certify that they meet criteria. So don't share those links with folks who should not get it. If folks do get it, then obviously anybody could sign up, but they are taking that responsibility when they sign up and register that they meet the criteria for the currently cleared population to receive the vaccine. As I said before, there is penalty of law and financial penalty if you violate that. So please just don't share it with any old body that doesn't meet the open group for the moment. Okay, I think I covered that. The next thing is just more housekeeping kind of pieces. So we do have our PPE pickup that will be on Wednesday. Hopefully everyone has submitted their requests at this point because we will start packing tomorrow. If you haven't, you may have to the end of this call to do so that we can get those plans ordered up and packaged tomorrow to be distributed on Wednesday, 9 to 10:30 here at Corporate Woods. Just as per always, I don't think we're going to be shy of any product line, so we should have everything like normal. So that is a reminder. We have the behavioral health call tomorrow at noon as per normal. We're back on normal schedule again. So those will restart and we will continue our Monday, Wednesday calls here as we have been. And then obviously if something changes dramatically in the days ahead, we can talk about whether we need any more calls or other emails to go out just to keep everybody abreast of changes that may come. Okay, I think I've covered everything I want to cover. So LJ, anything you want to throw in?
I don't have anything, Chad, unless there are questions from the team. Renee, do you have anything?
Behavioral health call tomorrow at lunchtime. If you already mentioned it, Chad, I'm sorry, I'm answering other stuff. That's all for me.
Okay. Chat room, is there anything in the chat room that we need to go through, or looks like everybody's talking to each other and that's good?
I think I'm seeing a couple of things there. Yeah, a lot of talking about vaccine and clinics and how people would manage or would prefer not to do that. Genesis Pete's just had a question about pushback from cardiology. Would they like to clarify what that means?
Does that mean?
Assuming that's on the return to play.
I try not to push back to anybody.
Yeah, that's Chad. We'll just take him out.
Exactly.
The thing that I'm not sure if this is about, I think that the cardiology teams have continued to try to work on their, with their phone triage staff about patients who are appropriate to come in, who are being referred in for assessment. Some of you have reached out to me. Doug Bennett says, cardiology receptionists say it's up to us about referrals versus EKG, but the specialists prefer the consult. So I think that I will just say to all of you on Wednesday, I will give an update on the return to play documentation. We are finally getting some new information from the AHP, a little more clarification around pieces of the guidance that were vague, but I don't have a final answer to be able to say anything today. So on Wednesday, we'll present on that. At this point in time right now, I do know sometimes when pediatricians or family docs have contacted cardiology with a referral, some of these have been declined. Initially, when it made sense for them to be seen, I think that they have figured out that internal piece, but it still has been a little bit confusing. So particularly if you're sending a child who has a past history of cardiac disease, clarifying specifically what that is really important. Because there are some kids who, if they had a past murmur, obviously, or a closed VSD, that's not the same issue. But it definitely, for a child who has more complex cardiac disease, there should be no question about that referral. So Genesis Peds, I don't know if somebody wants to unmute or they want to speak to specific things that are being told they're not meeting criteria. Upper age of cardiology follow-up recommended. This goes right up. I mean, essentially, your college students and older who are playing some type of competitive sports or very rigorous activity. The guidelines are the same. Chad can probably speak to that more. So peds cardiology will see up to 18 and older. We're encouraging those young adults to go to, teens and young adults to go to adult cardiology. There's Genesis Peds. Sorry, can you clarify?
Hi there. So we had a patient that had a hypoplastic right heart that was repaired, but she was positive for COVID. Obviously, per the algorithm, she screens positive to go because she has a history of congenital heart disease. And I went back and forth pretty much for an entire day with one of the nurses at Peds Cardiology about whether she met the criteria or not. I think Peds Cardiology was reading the algorithm as moderate symptoms and congenital heart disease. And the algorithm says clearly or. So that's one of the issues that we're having. Another one specifically today was a younger child, but still, is in kindergarten, who is having chest pain with exertion. And so that's, in my opinion, screening positive. And we sent the, return to play form that we filled out indicating that he had screened positive and a referral. And we were notified that we need to send them for an EKG. Whereas I remember the COVID Zoom that we had, Dr. Porter said that we didn't need to send anyone for any testing, that they would do it all. And, determine whether it was needed or not, cardiology would. So I'm just looking for clarification. And if other people have also had issues with getting things kicked back, or, just other issues with cardiology.
I'm looking to see if anybody else is commenting or if there's anything else coming in the chat in response. So definitely we'll defer if somebody else unmutes themselves and wants to add. I can tell you that I was consulted about that particular case, I believe, with Dr. Walsh. And so by the time I got to Dr. Porter, he had already been contacted by his peds nurses and he had clarified for them that patient, absolutely. It's exactly the kind of patient, the child that you spoke about initially, who should be seen. That's a significant enough cardiac history that child should be seen. Their concerns were more about kids who maybe had an innocent murmur that had resolved, or a child who had a VSD post-repair from years ago, that those kids might not fall into that high-risk category. I think that for the moment, if you are having trouble like that, please feel free to email me, because George Porter and I are going through this and using this to try to help his teams do the best job they can in terms of for the phone nurses triaging appropriately. if we're being asked to order an EKG, my suspicion is that is just to facilitate making this happen faster. So I would say if the cardiology team encourages making, scheduling EKG, I think we can do that. We've done that always in the past. And that may help inform the speed with which that child would be seen, or a cardiologist touching base with you about the kid. There's another question from someone, unidentified iPhone, in the chat. My understanding is that these are going to the cardiology nurses, but based on what you're saying, it sounds like it's more secretarial in terms of triage. I can talk to George about that as well. They're really trying to do a very thoughtful and efficient approach to this. But I think, as with anything, it's not just one person answering the phones there. So it's going to take a little bit to have uniformity. So the feedback that you give, as explicit as possible, I'll pass this one on, but if you guys have future ones, go ahead and send them to me. George Porter has been remarkably efficient, incredibly efficient in responding around these, and really does want the feedback.
And I'll just double in the question about the college age non-athlete. So I think we kind of came to the agreement that 18 and older could and should go to adult cardiology, just to ease the burden on the pediatric cardiology. There's a lot more of the adult cardiologists than there are pediatric cardiologists. So I would say, if you have high concern, we're not being overly aggressive about saying, oh, they're not an athlete. I mean, we know that college age kids tend to be more active in general. And I would be shocked to hear that adult cardiology is turning just about anybody away, truthfully. So if you run into any issues, certainly let me know. But I would say, for the 18 and older crowd, if you feel that they need to be evaluated, I don't think you'll have any issue. If you do, just let me know. I don't think that would be a problem. The other thing that I just recalled that is off topic, so feel free to continue to jump in about cardiology screening, because that's something I actually know something about for once. But for patient identification, so some of your practices, I'm sure you guys have it under control. You've got a plan. We have been working with the hub and talking about how we would go about identifying and reaching out to patients to let them know that they are eligible to get vaccinated. So just know that, obviously with the Arcadia, we do have some data aggregation where we can do that, whether that means providing lists to your practices, whether that means reaching out to you and saying, would it be okay if we supply these names to the hub so that they can reach out to people to get them vaccinated. I'm not sure what that'll look like yet, but we have been working with the regional hub about how we can assist or be involved. When I say we, I mean AHP at the moment, and helping to get that word out and get patients notified so that they know to come in and get vaccinated. So we'll be in further contact as some of these details flush out. As you can imagine, at the end of last week, we were all preparing for 75 years and older, probably to go live next week. And then the governor hit the accelerator on Saturday. And so all of those plans got moved up a little bit. So we got, as every time, got caught a little bit flat-footed. So there's been a lot of these discussions, but no bows tied on any of the plans. And now we're starting to tie bows. So we'll be catching up here in the next 12 to 24 hours. And certainly there are more details to come about all of that, even from the governor's office. COVID vaccination for those who've had COVID timing. Yeah, this is a great question. This has come up a lot, actually, so thanks for asking. So the CDC put out the guideline that said if you were within 90 days of COVID in positivity, so you've got a test, you're within 90 days of a positive test, you should hold off and wait until after your 90-day exclusion window, because there's every bit of data to suggest that you will have natural innate immunity from your COVID positivity, regardless of how much symptoms you manifested. That, my understanding was actually being interpreted as a restriction, that you could not get vaccinated if you were within 90 days of a positive COVID test. After I said that last week, a multitude of people reached out to me to let me know that they had been COVID positive and that they were within the 90 days and that they were able to get a vaccine. And in many cases, nobody asked them at all. So I think it is a relative suggestion that was meant to maintain the vaccine availability for those who would not have any innate immunity. So at the moment, I would still say it's probably advisable that if you're within 90 days, just to make sure that we have vaccine to reach out to the masses, use the immunity that you've got. And obviously, if a 1A person needs a vaccine 3 weeks from now, then they would go to the head of the class and be able to get in with really no anticipated hesitation. So I don't foresee that being a problem. I realize that I might be making promises that I cannot keep or deliver on. But for the moment, I would not say if you're day 62 that you need to rush and get a vaccine. But I also do not think that there's anything that is restricting you from getting that vaccine at this moment, in full disclosure. And that's the only guidelines that I've seen at this point. I've not seen any other more restrictive guidelines, and I don't think there's any firm screening being done to check on COVID positivity. Certainly there is no mention or effort or plan to do any type of antibody testing or anything like that. So it's purely going to be a Scout's honor kind of situation is my guess. All right. Any other questions that folks have? All right, looks like the chat room has slowed and nobody's coming off mute. So for the good of the day, we will adjourn. So we'll be back here at noon tomorrow for behavioral health, back here at noon on Wednesday for our fun and games. And then we will see you at 9 a.m. Wednesday morning for PPE distribution. But feel free to reach out before. Just don't give Renee's phone number to anybody. I've already posted on a lot of bathroom walls, but that was just for fun. So, all right, guys, have a good one. Take care.